This case was referred to us to evaluate the posterior maxillary implant site before sinus lifting procedure. In the sagittal view, you can obviously see almost complete opacification of the left maxillary sinus. You can also see some sparse calcifications at the level of the floor of the sinus. When we look coronally, you can see more of them, and we can see multiple air bubbles at the superior half of the maxillary sinus. The ostiomeatal complex is most likely narrowed or even partially blocked. These air bubbles is an indication of acute inflammatory changes. However, the calcifications on the floor of the maxillary sinus is suggestive of most likely a sinus disease of fungal origin. So in this case, we recommended not to proceed with the sinus lifting until the patient goes and referred to ENT to resolve the sinus issue before moving forward with a successful sinus lifting. In a different case, we have also attempt of doing a sinus lifting with a completely opacified right maxillary sinus. And most likely with these cases, which leads to complication, or at least will not lead to a successful sinus lifting. Sinus lifting procedure is mandatory when we have a sinus pneumatization or a limited residual ridge height.